Hello students. So now we are going to learn about the enteral feeding. So enteral feeding is nothing but the food is given in the form of like liquid or any semi-solid to the patients, that is mainly in the hospitals. So when they are not able to consume the food in the form of like through a mouth. So enteral nutrition is enteral feeding is supplying of nutrition into a digestive tract neither by mouth or by passing through the nose. So the tube may be passed into stomach. If you pass the tube into stomach, it is called nasogastric. Duodenum is a nasoduodenal. Jejunum is a nasojejunal. So when there is any obstruction in the esophagus, so enteral feeding is done by passing the tube to a surgical method to the abdominal wall, that may be to the stomach or duodenum or the jejunum. So then it's a image which shows where the tube is located, maybe the nasogastric tube, that may be in the gastric or jejunum or the nasojejunal or the nasoduodenal tube. And then another one is TPN, that is total parenteral feeding, where it is given to directly to the venous. So it is mainly the TPN is given directly to the venous or the central nervous system. So that is one more method is a percutaneous endoscopy gastrectomy, that is also called as the PEG feeding. So PEG feeding is given when the patient is having maybe the nasogastric tube more than 30 days. So if the patient is on tube for more than 30 days, so the tube won't work. So then we are going to do PEG feeding. So PEG feeding is directly to the gastric, which help to help of endoscopy without surgical cutting of the abdomen or the stomach. So it's an image which shows the PEG feeding, so directly connected to the stomach. So tube feeding. So tube feeding is a physiological, safer, easier, economical and better tolerated than the central venous feeding, and having better insulin response to the food absorbed through the intestine compared to intravenous glucose. And electrolytes or the trace element imbalance do not easily occur with enteral nutrition. This is when you compare with the central venous feeding, that is TPN. So the indications, so to whom we can give this enteral nutrition. So inability to swallow due to the paralysis of the muscle of swallowing, unwilling to eat and semi-conscious and unconscious patient, severe malabsorption and short bowel syndrome, burns, liver transplant and any other condition, maybe in the trauma or the accident cases, maybe in the case of fractures also it can be given. So type of food. So what type of food we can give? So we can go for a natural food as well as the elemental feeding. So elemental feeding is nothing but is a commercial formula. So whole milk or skimmed milk. So skimmed milk is nothing but removed with the fat, eggs, cooked and strained cereals, sugar, molasses, vegetable oil or the cream also can be incorporated with the feeding to increase the calorie and energy level respectively. And food formula also can be added to a different food to increase the nutritive value. So single food will not give a complete nutrition, that's why we are going to make a combination of foods, thereby we can increase the calorie and protein intake. So then blendalized feeding. So food are blended and made into a thin liquid. It should be cooked before you put into mixie. It should be very thin in nature and should go easily pass through a maybe tube. So it's a composition for the tube feeding. Maybe you can use this much amount of ingredients to make one formula. So if you use all these ingredients, there will be a good combination. So you can give it to patients. So it is very rich in nutritive values as well as the protein. So water is added to make the volume up to 1500 ml, and each ml should provide 1 calorie. So if you give 1500 ml for patient in a whole day, then you should give 1000 calorie and 1500 calories as well as 50 gram of protein. So in this feeding also you can use starch, milk, skimmed milk, egg, soya and refined oil or salt. Maybe you can use coconut oil also, it is a MCT, so that also will helpful. So then patients with the pancreatic insufficiency or the malabsorption may require elemental formula. So elemental formula is nothing but it's a commercial formula. So feeding requirements, a concentration of 1 kilocalorie per ml is satisfactory. Concentration of 1.5 kilocalorie per ml is given for the patient to increase the calorie needs of patient with fluid restriction. So greater concentration, maybe there may be chance of some diarrhea, or it may be, if it is too thick, it won't be passed through a tube. So this is a feeding requirement. So fluid, it should be 30 ml per kg, and maybe energy 32 kilocalorie per kg body weight, and protein 1 gram per kg body weight, and sodium it is 30 to 40, and potassium 1. So different infusion techniques. So how we can introduce this feeding? So there are methods of feeding, how to infuse, how to you are going to give. So continuous method is a feed via a infusion pump or the gravity flow. So we will hang the bag, gravity bag, and 50 ml per hour. Then cyclic method has off and on method in 24 hours. For example, 8 hours we will be giving, then we will be giving for 16 hours off. So then one more, the regular, and maybe you are giving a short break, maybe in 24 hours, maybe 4 hours will give a feeding, and next 4 hours you will be wash. So one more feeding is a bolus method, where there is a large volume is given at a short time. So maybe at a whole, maybe if you take a 1500 ml, so it is given at one stretch. So that is maybe minimum for 10 minutes. Okay. So then all these are methods. Maybe you can use commercial formula in particularly their disease condition. Maybe renal, there are renal supplements, and in the maybe in diabetes there are many other supplements, as well as maybe in burn cases they are going to energy rich, protein rich. So it depends upon what the patient is having the disease, what is the type of disease, as well as the electrolyte balance. So here you have to take care of electrolyte balance, because there may be chance of maybe it may increase or it may decrease, as well as when you are giving the natural food, maybe the natural food, maybe the rice or the cereals or whatever. So that also should manage with the energy requirement as well as the protein. So if you are not giving sufficient amount of protein or the calorie, what happens, the patient may be malnourished, or there may be chance of muscle wasting. So these are the types of feeding, how we can give enteral feeding. So this is about total complete about the feeding. So hereby I am stopping this. So then we can learn in the next class about the parenteral feeding, where it is given directly to the central venous. Thank you.